Most of the time, when they consider breast cancer, we talk about it because it is hereditary.
Cancer itself is the proliferation of abnormal cells in the body. So, breast cancer is when that abnormal proliferation occurs in the breast.
Another thing we need to emphasize on is we should know our body. You know, any slight changes, you will seek help quickly and faster.
Obesity, that's
Yeah.
if you weight past the normal,
For the
when you forget as woman, then they also dispose you, they expose you, put you at a higher risk, forget breast cancer at the end of the day.
Smoking and alcohol.
even secondary smoke. I mean,
when you dey
so
inhale
that
and
is the way
in
the
fact,
country
in
don
fact,
put
with
a
the way
ban on
how we
that.
dey now, so then they go say, and they smoke cigarette,
But you
and
dey
they
near
smoke
for-
jamba,
But
but they
it's
smoke
like-
shisha.
Breast cancer doesn't just happen in women. Men can also get breast cancer, even though it's not very
Minimal.
common. But men can also get breast cancer. So not say, oh well, me na man, even if you dey na me family, it no matter.
Yeah.
You're still at risk.
Hello, people. This is the Healthy Mind podcast. I am Fam Diane and I'm your pharmacist and your host. Thank you for liking, commenting. Thank you for subscribing. We are watching and we are also learning from you. Thank you very much. Today also I have with me my beautiful ladies, the farm ladies. Please say hello to our viewers.
Hello.
You see them, They are beautiful. Thank you very much. We are looking and we are observing the support and we are grateful for all you have commented and your likes. We appreciate all of that. Today we are looking at the topic for the month. This month we are observing the breast cancer awareness month, right?
Yeah.
And so far, we know even though men also encounter the breast, they suffer the breast cancer, women also suffer it. In fact, a great lot, Yeah, we women, because the breast, when they talk about breast, you think about a woman most of the time.
Yeah.
So, as we're observing this month, we are here to discuss about it and learn from each other. What I want to start with is most of the time when they consider breast cancer, we talk about it because it is hereditary. And in our setting, we hardly ask our parents questions.
Yeah.
Most of the time, we have grandparents who suffered it and probably died from it. So we don't have that information and we carry along in life not knowing much about it. And after some time, you get symptoms that are weird and we don't know what to do. Today, we're here to discuss it. What have you observed lately? Because awareness, I'm not sure if we have done that well in Sierra Leone. Have you observed anything concerning that in this part of Africa?
Yeah, I mean, breast cancer, as most of us know, is cancer itself is the proliferation of abnormal cells in the body. So, breast cancer is when that abnormal proliferation occurs in the breast. Yeah, so in the breast tissue. So, when that happens, it results to cancer. And like you were saying about the hereditary part, breast cancer is associated with hereditary factors, meaning that if it runs in the family, like if the immediate family member, like the mom or the sister
or the grandmother,
then one of the other member of the family can come down with breast cancer. And like you said, breast cancer doesn't just happen in women. Men can also get breast cancer, even though it's not very
Minimal.
common, but men can also get breast cancer. So not say, oh well, me na man, even if you dey na me family, it no matter. You're still at risk. So you have to watch out. And
there are many ways we can identify something abnormal that's happening with our breast. We will need to discuss that. Firstly, I will start, normally I would always say, know your body.
Yeah.
Know your boobs, know your breast. So if you know, I've never seen or experienced a lump, then it's something that you should pay attention to.
If it's something you
other-
touch on a normal basis.
Yes, you should touch it on a normal basis.
I think that's the main thing. Looking out for something different in your body.
Unusual.
Unusual. If you wake up today and you notice, my breast was soft today, it's a bit tender.
Yeah.
There is something going on.
Yeah. We
It's
should
a
know our body. Yeah. What other factors are we looking at?
Change in shape also.
Yeah.
We all know our cup sizes, breast sizes. And
We all know
everything.
our cup sizes.
Okay, breast
I
size.
love that.
We know our breast sizes,
Yeah.
and if you get up and you think this one is bigger than the other, I know there are certain times of the month you feel
Heavier.
it's
Tenderness.
heavier, it's tender,
Sensitive.
it's even warmer to touch.
Yeah.
But when it's prolonged, don't pass 2-3 days, it warm. You don't one day big, the other one small. It's a cause for concern.
Yeah.
And also the color.
Yeah.
Yeah, especially for those that are,
So we're black.
well, you're not too black.
You know your color. You
Yes.
know the color of the one you have.
Once you see something different from
Yeah.
what has been there, then you
Yeah.
know, oh, this is a call for
Something.
alarm, you know. And also, if your breast starts secreting something like a bloody
Yeah.
fluid
Discharges
or
that
so,
you've not
yes,
been having.
that's also a call for alarm, you know.
Yeah.
Yeah,
also
and
alarm.
we should be careful when we are looking at the signs for breast cancer
Mhm.
because first of all, when it comes to body symmetry, no two sides of the body are the same.
Yeah.
So you
One is
one
slightly.
yes,
One
but
is
that's
slightly.
significant where
Change, yeah.
Growth,
you
yeah.
two body they're not going to be the
Noticeable.
same
Yeah.
size. But if you notice some extraordinary largeness
Yeah.
in one and the other one said they
Mhm.
shrink, then that is something to be looked at.
And not to
Yeah.
say being day.
Yes,
I
And
think
not
that's
to
the
say-
main
yes.
important
If you not
thing.
been this so,
Mhm.
now you don't
Mhm.
begin this so. And another thing again, the time of the month for the woman. Now, when just before the period they come, we get what they call PMS, premenstrual
Premenstrual.
syndrome. You can get tenderness of your breast.
Sure.
You dey feel
Because of the
moody.
hormonal changes.
Yes, because of
Sometimes you even
yes,
feel
you
pain.
hormone. Yes. So now, if you look at that time, they say, "Oh, while I don't follow, I don't get breast
Mhm.
problem." You may be wrong.
Yeah.
Yes. If now outside that term day, let's say you period done, if your ovulation don't pass, you're just waiting for
Yeah.
The next.
then you begin to observe them and they significantly, then you should go and get checked. But if now around that time of the month, if you check, you might miss it. If you check and decide, say, oh, I don't check, I dey feel this pain, it's tender, it's sore, this and that, you might miss it.
Yeah.
It may be say cancer don't start, all right, but that may not to the right term for check the breast.
Yeah.
You can wait like 10 days after your period, you can check also and so
Most
on.
women wait for pain. And I've learned that pain is the last thing you'd experience.
Well, not always.
Not always, but most of the time, there are signs we ignore.
Mhm.
You check your armpit and the lymph node there is swollen. You say, it's normal, it will pass. So they are waiting for that pain that will take them out of their comfort zone and say, oh, this is the breast cancer that they are talking about.
That is very true for a lot of
Yeah,
Sierra
most of
Leoneans.
us wait for pain.
People
In
wait
general.
for water don't pass gari, water don't pass flour
mhm.
before they rush for do something.
And sometimes for some
you have
people, it's
to
even
beware.
their partners or their spouses who even take notice of the
Yes.
changes.
Because the
in their-
partners are touching the breast more.
Yes.
You know, it's funny.
it's true.
You
No,
have your breast.
that's why we also talk to the men.
Yeah.
Yeah.
You know what you are used
You
to
are used
seeing.
to touch and
You
what
know
you
what
used
you
to
used
feel.
to feel.
Yes.
And if there is changes, you are the first to see.
Yeah.
Even maybe before the one that has the breast,
Mhm.
because you make
No,
good
I
use of-
think
it's
the
true.
owner of the breast should take ownership of the breast.
Yes.
I think
no
that's-
one is
now that's
no one is
what
claiming
Yes,
ownership.
yes.
We're just
No, the
trying to
owner.
sensitize
The owner, I don't
men.
understand. The owner as in
As
The
in
men.
the
My
man,
No, yourself, you are the owner.
the owner, the carrier.
The
The
carrier.
Yes.
Okay.
We should know our body because
Yeah.
then you observe whilst you're washing.
Mhm.
Sure.
You check. There are things that are going slowly.
Mhm.
You can pick it up and you get help
Even when
immediately.
using your bra, for example,
Yeah.
Or your body lotion.
you'll be able to tell.
Yeah.
Because if before when using your bra, this side of the breast doesn't fit so well into
Yeah, then you
the
observe
cup,
it's a
and
bit
now suddenly you see
fuller.
it. So that's also something you should check again. But we'll get to that point before the podcast.
So it's
is over as
difficult
well.
sometimes for women to take notice of their breast because it's just common that you have the boobs. I mean, we take them for granted
Yes.
because they are part of us and we've seen them ever since we turned teenagers. So it's not easy for like just grab a begin take special care for you, Bobby. But I think we have to practice that because, like they say, you don't get to the end of the road just like that. You start somewhere. It go don't start with small lump, small boil, small pain where you ignore, something where you know they notice, small rash where you see, small discoloration, it scratch, you the scratcher. This me Bobby.
And you enjoy
even take comb, begin the scratch. We say, na the scratch or scratch to blood don't come, but it's something more than that. So we have to be more intentional about
I've had a friend who called once and she was having discharges and she's about the age 35 and then, you don't have any child and at this age you're having it, so it was continue for a very long time and we had to get her to the right place for advice or help. So these concerns, it should be known that there are signs that we should look into and don't just say nothing in the past. So even
you say they pass, you said don't pass.
So nothing than the way we always for watch. Apart from the heredity factor, where they expose, because if you granny getter, you
likely for age.
So that same way, well, some people actually don't know. They don't know. They don't know because if they have not been diagnosed with that thing, they'll just know that grandma just died, or mommy just died.
Well, the thing about breast cancer, it will show in the breast, so you definitely.
Well,
know.
it's about informing the younger
generation.
Sure,
but how would you know if you're not being?
For example, if you're a third generation born,
how will
you know?
Even there are times it skips generation. Well, in that if my grandma has it, it will not necessarily show up with my mother, but it will come to me like that. So it skips. But that's why we really need to talk to our younger generation. Some things you ask them, have you experienced this? Even with the periods, if you watch, if you actually ask questions, you know that about the same time, about the same age, that was when your mom got yours, that was when you got yours and your sister. And if we don't, we shy away from all of these things most times because we don't.
I'm sure most of them they are ignorant.
Another thing we need to emphasize on is we should know our body. Basically,
very important.
At times, let's say you granny within a village, you don't know waiting killer or they say na which.
As John said, I go there you know nobody.
Now make it die, you don't know. But if you know your body, you know any slight changes. You go seek help quickly and faster. We go help you a lot.
We go save you.
So we need for promote self-care.
Self-care. Know your body.
I don't say growing up, it odd and say a man na for no woman body. You the woman you go there, you know if it's a vagina.
No, that's bad.
Well, if you say odd,
that's bad.
For watch.
That's ugly.
So
very ugly.
You should.
You need for.
So you know the changes.
Exactly.
You know how the normal.
So I'm not saying that you breastfeed so easy.
Yeah, easy for access.
Easy
vagina
for access.
Even easy for no. Some man not even sabi in urethra or
now you sabi that. Now you know landing.
Some man no know. You just feel say that same passage na
dey. You really come out. What's the pikin come out?
No.
So apart from the heredity factor, we also have age. We learn say age as you go older.
They go.
Actually, learn about the 40,
45.
above that. Then
they increase your chances. Also, with the way modernization, it don't bring a lot of processed foods, canned, tinned, and canned. And all get preservatives them. And then when they predispose with what they do, they open way up for make the cells they just may they continue for multiply fast, and then it results to cancer.
Yeah.
And also the weight and obesity. That's the weight pass the normal. When you forget as woman, then they also predispose you. They expose you, put you at a higher risk for get breast cancer at the end of the day.
Yeah. And if you want for no waiting, you wait fit for you age, you can go na hospital or any pharmacy. They can check out for you.
Your height and your weight.
So that they check your weight, then check your height, and then get the calculation where they do. Then go able to tell you if you then at the right range, or if you then at class 1 obesity, class 2, or
not from 5 obesity.
So, or you they overweight, they will able to tell you. So you can go na any health facility.
I'm sure we've had experiences before with people having to lose one of their breasts.
So when I'm small, I been get one neighbor when they tell them you know me no expose breast cancer, no be no expose this much. So they been get for do in surgery and pull one part of the bobby. When something then they sit down we get one bobby. But I think say because in them being detected early and do in surgery, he's still there alive.
So it's important.
Well, they go work, take care of him, picking them, take care of him in waiting. But if they're not detect an early and do the surgery, it can lead to death.
Well, when you say if they're not,
I mean, if the person you don't see, you notice say I get this thing this way where I the difference one day, difference one day, then you go see your doctor. You don't go to hospital, they not watch you. They're not able to tell you say yes, so this thing will be the suspect now in or not or in early detection. Like with every sickness, early detection saves. So like when they know and quick and be able for performing surgery, and she's still alive.
Me self gets experience, but me now, sadly, we lost some. I mean, auntie.
Late detection.
Exactly. They actually detect her more lately. They do the operation, but at the end,
it don't spread.
It don't spread all over my body.
Just like Angelina Jolie. We all know the story of Angelina Jolie. In mama we get breast cancer they run in family. So waiting in do, he not even wait for anything show up. He go, then go check them, then check because then get the test the way that they run for determine the genes then where they predispose you, where they make you susceptible to having breast cancer. Then check, then see say you get all to the gene them, and then say no waiting, una pull all to the body. And they even take off in ovaries as well. Because breast cancer and ovarian cancer are 5 and 6. A collabo. So you see one, the other one
high chances. High chances.
So they're always the worker, and most of them cancer so they affect women. And once one don't affect them, I mean the likelihood for somebody even cervical cancers themselves where they affect women. So no left they treat infection all the time that you get infection. Sometimes you cervix step and get that.
Very true.
You know?
You'll be having itches.
Exactly.
Different changes in the skin. Then you'll be buying antibiotics.
Yes, see the rubber.
Antibiotics.
Go get checked.
You know, I also observe women they really smoke. One, you don't know your status. And smoking and alcohol.
Even secondary smoke. I mean,
when you
in fact, with the way how we did now, so then they go say, and they smoke cigarette too, and they smoke jamba, but they smoke shisha.
And your boyfriend they smoke.
So now all they chill.
You're smoking it as well, my dear. Yes,
you're exposing yourself. And so another thing for also encourage exercise. Because hormonal balance very good for women. We as women because they maintain the hormone stem. So what are the things they do for look out for we keep in check for health lifestyle changes? We go help women most especially for maintain so that go live a healthier life in terms of the breast.
So me go say we diet. No learn no more thing if you go eat. Learn for cook for yourself. Tell if they beans. Fresh pepper,
healthy meal,
and no overcook food.
No cook
green pepper
all the good
black.
You overcook, so they lost all the nutrients we need at the end of the day.
So if you eat healthy also, it will help you.
And sleep. Sleep does a lot for the body. When you sleep, your cells that they do a lot. Then they take time for clear your system, rejuvenate, heal, and all of that. So if all net you sit down on WhatsApp, na TikTok, you watch people that they dance, sleep till 8 o'clock.
They create content.
They create content. Then they'll clean. You don't wake 6 o'clock. Yes, now you don't jump na sleep back. They sleep. When you cheat nature, when they collect back,
they even know when. They even know when.
Then this again, Diane, not just an eye opener for people then. When you see all them symptoms, or you feel all them symptoms, you begin to see them signs there. Not already put on your mind, say, oh, health in mind podcast on talk statement, this way, now breast cancer and all, you begin to overthink, and already they give body the information saying that then day you want calm down with. The best thing you can do, go check.
You can find
be sure
doctor for talk to, we're going to lead you. Probably not even anything, but if I know more, let you notice. Be sensitive to yourself. So you can get a doctor and tell us, now this is how they feel. They can guide you. But not so, in fact, when you panic, it actually affects you. They bring down the immune system and then they work.
I don't allow anybody for intimidate you. Oh, you like for check.
Yes, what
defend you go get her. I rather know what is going
on
than not know and later find out this in our
too late.
It don't be too late.
And let you check her, are you body?
It's yours,
you know they pay anything for check
no, wahala. So we also one for the life. We get Well Woman Clinic. We do very well.
And the Think in Pink
Breast
Cancer
Foundation that they do very well. And they don't master this thing for a very long time. Then get well experienced nurses. We go take you through and give you details about waiting for do and how to go about it. So the Well Woman Clinic Day by Congo Cross Moriton Junction. Then the Think in Pink
Pademba
Junction. Yes. Now people in we don't master that this kind of condition and they know waiting for do and they know how to guide you. So please, if anything come up, don't hesitate. Nobody condemn you. Yes, with love, they will take you through so that you avoid any unnecessary loss so no one's right now.
And this is the month of October, month of breast cancer awareness. So I mean, there are a lot of promotions going on.
The Woman's Place also they do.
I even visit Think in Pink. Was it last week or a few days ago? And then do me breast examination, then check me blood sugar, check me hepatitis
which is
status.
Good.
So and it was all free.
Regular checks, very, very
so
good.
In this month, make use of that day.
Yes.
Make use of that day. And not just for this month, every month.
Every month, the month just raise the awareness so that every other month you can take care. Thank you very much, ladies. It has been a wonderful talk. I really learned a lot because that topic people they actually address all the time. And we will keep on the talking because not only in the month of October. Thank you, viewers. I know say una self dollar. I know you have been enlightened, insightful information they don't come out. And please don't forget to like, don't forget to comment and subscribe. We're watching and we appreciate you all. Thank you. See you.
Bye-bye.